Yeah, that was a crazy night. We drilled and drilled over and over what we do in an emergency situation. So I, very quickly jumped in and ran up to one of the floors of the hospital and saw that really it was very orderly. People were focused on taking, especially the most critically injured, out of the hospital first. I went down after just really helping one patient because we had plenty of help there. So it was an interesting evening that night. We're really within a week of the storm. We had the tent facility up, which is kind of like an old MASH hospital that you'd see our military using out in the wilds. We had that up in 7 days, and it immediately became full. Poor Freeman was just inundated with people, and so for us to even have that very reduced, but at least having a service up was a big help, I think, to our communities. And then in August we moved to these modular buildings, so truly kind of a set of modular buildings that were connected together, intended to be a hospital, so it was really very cool, a company that had specialized in this. So this modular facility was great, but we knew it wouldn't work long term. So immediately we began making plans for putting up what we call a component-built hospital, is the one we have now. But it's a beautiful permanent facility. It was built in these large components, 14 by 14 by 60 foot long, trucked across the country. They were built 85% complete, so the job became to put them together and then make it into a hospital. It still doesn't get us to the capacity that we've been in, but it gets us much better. The new one will allow us to work in a very new model of care, and I think that's going to be required in our country. Most facilities like that would probably take 5 to 7 years to build, once you count all of the planning and design that goes in. So we're shortening that time frame. So a lot of work's going on that. So we're really excited about what the new hospital is going to bring. It'll be beautiful, it'll be very accessible, it'll be easy for people to get into, with truly state-of-the-art equipment on every level, with every service that we provide. I mean, still today, we don't have enough beds. Even our new component hospital filled up very, very quickly. And so in this region, we're still not meeting the need. And I know Freeman's done a great job. They've brought other beds in service, but so we still feel very challenged to provide the services we need to challenge. And this component-built hospital, as wonderful as it is, isn't where we need to be long-term. So that's why we look so much forward to 2015.
I arrived at the hospital probably less than an hour after the tornado hit. And by the time I arrived at the hospital, it was already filled to overflowing with wounded patients, family members, volunteers. Every square inch of our hospital was covered, basically. I know that the night of the tornado, we saw roughly 750 patients that night. We did 22 life-saving surgeries within the first 12 hours. So it was a very busy place. There were lots of people with very serious critical injuries. Never was there a drill in which there were so many circumstances working against us as the night of the tornado presented. So we had an overnight significant increase in our volume. And that presented a challenge right away, how to take care of those patients. Since the tornado, we've hired about 35 new doctors and about 329 new nurses. So you can see the amount of staff that it took to handle the additional volume. In order to really meet the needs of the community, it was essential that very quickly we gear up some services. So we actually have 10 construction projects that are in process or have recently been completed. The very first one we did, which planning began the night of the tornado, was to finish out the 5th floor of our tower. In April, we opened 29 new private beds, and that helped a lot with the shortage of beds that our community was experiencing. We are also currently in the process of finishing out 29 more beds on the 6th floor, and those will open in September. I am incredibly proud of the Freeman Health System team for not only what they did the night of the tornado, but every day since then. They have handled more than they've ever been asked to handle before, do more than they've ever been asked to do, and they have done that in remarkable ways. Our team has worked relentlessly to care for our community and provide the very highest quality care. And I am so proud of them because not only have they met that increased demand, but they've done it in a way that optimizes quality outcomes and service for our patients.